Hi, everybody. Well, I had a situation today, and I know what you're thinking. You're thinking it's the bug eating episode, and unfortunately it's not. I had a situation today where I actually got a laceration, and I thought this is a perfect teaching moment because I do my own stitches, and a lot of times when people are backpacking, you are hours, if not days, away from being able to get treatment. So I'm going to teach you how to do your own sutures. Heads up, there is a huge pain factor in this. You have to actually have a pretty strong pain tolerance, but you only have 6 hours to do stitches, and a lot of times when you're on the trail, you are definitely past 6 hours away from actually any kind of medical attention. So you might have to fix yourself up. So the first thing, it happened on my leg. So the first thing we have to do is open the area, and no offense, basically I'm not going to drop my trousers on YouTube.
Oh, come on. Why not?
Sorry, not going to happen.
Well, still expose that sexy leg.
We have to expose the area. So I open up the pants. I already have a bandage put on it. It's not that bad of a laceration, so I don't, need to worry about anybody passing out that's watching this. But it's definitely one that needs stitches, and it's a great teaching one because Angel has never done a stitch before, and she's going to learn today how to do one.
Yay, me! Not really all that excited.
So,
because I don't like when you get hurt.
That's the wound.
All right. Extreme close up.
A lot of people ask the question of how do you know if it needs stitches or not. If you could see the inner meat inside it, then it definitely needs sutures. But the first thing we have to do is we have to clean it. So, and
hit that baby with some alcohol.
This is the only thing that I trust, especially backpacking, is alcohol. Hurts something fierce, but it needs to be done.
Ooh, I'm cringing, and it's not even on my leg.
So there we go. We got the area cleaned. Now, there's two ways to do sutures. You want to keep pressure on that until you start working on it. But you can actually get suture kits off of the internet. Strangely enough, though, they're meant for animals. Now here's the best part. Anything for animals can be used on humans, as anybody who wears makeup knows. So these are the kits that you can get. Those are suture kits. But a lot of people don't have suture kits with them along the trail. But one of the things that a lot of people have is they have dental floss and they have a sewing needle. So the first one I'm going to show you how to use dental floss to stitch yourself up. You always want the waxed dental floss. This will not degrade in the body as it's starting to break down. So you always want wax because it'll make sure that the stitch stays there.
And you like the minty flavor.
I do like the minty flavored one. However, this isn't the mint flavored one. So you're going to take your dental floss. You're going to take your sewing needle. You're going to run it through. Oh, look, I'm probably going to be doing this like so. Hey!
First time.
I was a little bit worried there. Thought it was going to take me a couple tries. Pressure.
Feeling a little bit, are you?
Nah. So now, a sewing needle, I sharpen all my sewing needles that I take on with me on backpacking trips because I always take needle and thread because you never know if you have to repair something in the field. And you also want a sharp needle because this stitching skin is the equivalency of stitching leather. It's not like running it through cloth. Now, when you use the dental floss method, and again, we want to sterilize all of that, so we'll put that down there. We'll hit it with some alcohol. Run that whole line of dental floss through that alcohol. Get it well saturated.
So that way it burns all the way through.
So now, because it's flesh, and like I said, it's like leather, what you're going to need to do
Oh, God damn, that is bad.
is get pliers. Pointy nose pliers is my multi-tool that I always take backpacking. Get pointy nose pliers, and we're going to do the first stitch. So I go about that far up, hold that together, go a little bit of ways. Quit cringing. It's me that's
I know, but still,
But you push it all the way through. Keep pushing all the way through till you see it come out on the other side.
Not out yet. Oh my God, it's not out yet. Okay,
Yeah, it is.
It just poked through. Oh.
Grab the other side with the pliers.
Oh. Are you sure I shouldn't just take you to the hospital?
No. This is kids play. So
Really?
you pull that through. Go ahead and put a knot in it. You want to make sure it's nice and tight to hold that together. Put another knot in it. You want to put a couple knots in it because you don't want it going anywhere. And that's the first stitch. That's simple. That's the dental floss method.
That's simple?
It is that simple.
Oh.
So.
I just want to kiss it and make it better.
No. It's alright. Once again, dab it and clean it with the alcohol. Now we're going to use the prescribed method that you can get off of, believe it or not, you can get it off Amazon. I've gotten these stitches off Amazon. They have different levels, 2, 3, 5, and a 4. We're going to go with the 4 on this one. When you open up this packet, and this is totally sealed and totally sterile, but when you open up the packet, what you will see is a little disc that has the thread and the needle already attached and everything. A curved needle, which makes it a lot easier than continuously using the other one. So that's it right there. So let's go ahead and throw this stitch in, and then I will have Angel do one. What you want to do is hook this like that. So this is where you got the curved needle. You come under, push in, and then go up. This is a cutting needle, so you don't have to push as hard as you did with the plied one. Once you get that, pull this up, go all the way to the end, and we're going to knot it. Going to knot it again.
Yeah, I don't do so good when it's you being hurt.
Well, next time you get cut, you can do your own stitches. But for right now, it's me. You have to learn how to do it first before you can actually do it.
I don't know about that.
So, okay, so there's that one. We'll cut that off. Clean it again with the alcohol solution. Actually, not even a solution. It's just pure alcohol.
I was about to say, boy, we didn't salute it with nothing.
All right, now let's get Angel in here to do
Are you
the
sure
last
about
one.
this one?
I am positive.
All right, let's put the camera down somewhere. Well, actually, it's not going to be able to be seen as close up.
All right.
What did I get myself into?
Come over here.
Come over this way.
No, right here, just
Right
as you
here.
are. Take that with your right hand. You want to hold it up here like that. Okay, now you want to pucker that up. Take your other hand and pucker that up. Now angle it down and angle it up and through. Yep. Nope, farther back. There you go. Watch your finger. You don't want to hit your other finger. You gotta push. Gotta push.
I know, but I'm gonna hurt you.
Gotta push.
I'm gonna hurt you.
Push. Push.
I'm pushing. It's
Push.
not coming. No. Oh.
There
It
you
just
go. Now unclamp the needle. Perfect time for the phone to be ringing, right, folks? Never fails. I get hurt, I gotta get myself stitches, the phone starts ringing. Now pull it up and through. Next time I'll have to silence that. Good job. Now you pull it all the way up.
Alright, now what?
Now knot it.
Just like normal?
Like a normal knot.
I'm shaking.
I don't know whether you're doing it too.
I know, and I'm shaking like a leaf.
Pull it tight. Then you go a second time. Pull it tight. Cut it off. A little bit, leave about a ½ inch above. Yeah, that's more than a ½ inch, I think. Right there.
That's so interesting.
All right, see? So there you go. That's a real simple way to save yourself a boatload of trouble and time in the wild on doing your own medical repairs. Everything all squared away. It's all sealed. Now we're going to put a Band-Aid on it, wrap it up, and everything's good. So hopefully it never happens to you, but if it does, at least you guys are prepared. So keep on adventuring. You guys have a great day.